Okay, let's start today's lecture. Let's welcome Dr. Gao.
Thank you all to join this virtual Zoom meeting. It's about vision health and how to use the easy acupressure to improve the vision health. It was originally designed for children's vision health, but it's actually good for the whole family. Before I start this lecture, I would like to introduce the Accompany Children to Grow Healthily initiative because I have seen many new new friends. Right? So we had one English lecture back in February, but today I see many new faces, new friends. So I would like to share the screen of to introduce this initiative first. Okay, can you guys see the share screen?
Yes.
We
All
can
right.
see the share screen. Yeah.
Okay, so I the organize of this lecture is run by Accompany Children to Grow Healthily initiative, and we are a group of enthusiastic practitioners, Chinese medicine practitioners from Canada and USA. We also got special academic support from Chinese TCM associations and Changsangjun Classical Pulse Associations. So we got authentic academic support from China. So here shows who we are. The initiative aims to improve children's and youth's health in our communities in North America by advocating healthy diets, healthy lifestyles, and providing free health consultations. We are committed to ethical and professional standard practices to meet the requirements of the bylaw and regulations under Health Professional Act of Canada and USA. Right now, our current focus area will be food intolerance, food sensitivity. As we know, so many children develop eczemas, asthmas, and different disease is all related to food intolerance and food sensitivities. So we also focus at asthma, chronic cough, hay fever, and pediatric snoring. Right? So it's an interesting area. It's actually many children snores at nighttime, right? Not only adults snores, children snores. Also, for sure, eczema, skin disease, vision care, all this is tightly related to a healthy development of a child. We also would like to stress more about pediatric emotional distress, and then we will teach more pediatric meridian massage. So these are our current focus areas. Since pandemic, we could not run any live events or in-person events. So from end of December to now, we have run 6 online Zoom lectures almost once per month. And we are looking forward for a real in-person events after pandemic. So that's and how can you join us? We already developed a Facebook group. It's called Accompany Children to Grow Healthily, and you can for sure join our Facebook public private group. It's not a public group. Facebook private group. We also set up a YouTube channel. It's upload all the lectures we have run. So even though you miss lectures, you can still go to YouTube channel to learn. For sure, welcome to email us if you have any questions and concerns. Right now, I would like to introduce our free consultation procedures. So how to join the free consultation? Step 1, request by sending an email. And then when we receive your email, and then we will email you back a health information questionnaires and consent form. So after you fill in the information questionnaires and sign the consent form, we can start a process of a virtual consultation with you, right? So we'll reply by email, set up a free telephone, virtual, or face-to-face consultation, depends on different circumstances with the parents and the kids. So all these are free. And then last steps is we will provide you health suggestions, right, from registered TCM practitioners in Canada and USA. So we will give your child a full assessment and some practical suggestions, right? And then we'll follow up with you. If you need us the referrals, we'll refer you to your local acupuncturist or Chinese medicine herbalist. So this is our the procedures of how to use our free consultations. So that's the introduction of the initiative. Is it clear? All right. So the next one, I would like to share our YouTube link because many people don't know that. Let me see, where is the YouTube link? Can you see my screen, the YouTube link?
Yes.
Okay.
I can see it.
You can see this is how and when you see Shippy, you know this is a Shippy. You know this is the our YouTube link. So it's called Accompany Children to Grow Healthily Initiative. You can subscribe. When you click the playlist, you can see we have 6 lecture videos and 22 small clips. So the small clips is very short individual videos on each topics, and then but we already have 6 lecturing videos. So for example, each lecture video is around 1 hour, and it has a day and time, and then it also have a title. For example, this is a Chinese one about pediatric massage for lung health. Right. So if you, this is the first one, and then if you go back to click the small clips, you can see there's so many small clips on pediatric massage. It's in Chinese and English. So every topic will deliver in Chinese and English together, not together, just separately, but we'll provide you both. And we also even provide Cantonese speaker, Cantonese lectures. So this is a very complete session of our past lectures. So don't worry about you miss any lectures. Okay, so far so good. All right.
Thank
So
you.
without further ado, we will start our today's lecture. Okay. Let me share screen first. So after I share the screen, I couldn't see anyone. Okay, I only can see my screen. So my team members, Bobby, Wendy, or Shiming, would you, so and also Doris, please pay more attention to other parts. Okay, let me get ready. And if you have any questions, please type in the chat box. So today's lecture is about vision health. Okay, about vision health. But it's not, oh, I call it acupressure, but it's quite advanced acupressure. We call Sinew Therapy. And we are luckily, we invite strong traditional medicine Sinew Therapy specialist, Dr. Jiafeng Ren. He's from Beijing, China. Okay. So he copy his videos, and then we are able to deliver to you. So Zhuang traditional medicine is based on traditional Chinese medicine, but Zhuang is a minority in China, so they also develop a very unique techniques and some unique points. So it's already, this is called intangible cultural heritage. So it's already it's a very, just let you know, it's a very valuable one. So here is the brief introduction about this Zhuang traditional medicine. So you can see Dr. Jia Fengren is a specialist and today's guest speaker. And he's very famous in China and always they promote Zhuang traditional Chinese medicine in different TV channels and practice in Beijing. Okay, so why we need to talk about the pediatric nearsightedness? It's more and more children develop that at younger and younger age. So when you see this page, you can see how worse it impacts the children's health and how worse it actually impact our society. Okay, so that is the statistics. And we will focus on today's lecture will focus on number 1, myopia and causes. Number 2, the impacts, the negative impacts for nearsightedness. And then number 3 is our valuable video clips to teach you how to perform the Sinew Therapy. And then number 4 is the checklist. That's today's main content. I will try to finish it in around 40 minutes. Okay, so myopia and causes. So what caused that? Here we talk about the outdoor activities. So some children may be lack of outdoor activities, but in Canada, I don't think this is a cause, but still in other part of the world or other area, probably they don't have enough outdoor activities. Okay? So bright outdoor sunlight would help children to have healthier eye contact because it releases the dopamine from the retina. Is known to be stimulated by light, and dopamine can act as an inhibitor of eye growth. Okay, so this is a quite important to prevent the outdoor activity can help the healthy development of the vision for children. So we also attach some references for you in case you need more further studying or reading. Physical activities, it's also very important, especially for small balls. small balls, not big balls. So small balls like badminton, tennis, golf, right? Those small balls can help children, like basically they need to focus a lot at the small objects, right? So that it's also, they need to track the balls, right? And that is very helpful to strengthen the muscle in the eye socket, so to control the eyeballs, right? So that is a small balls activity. And other part is the signs, like, so how do you know your child have already developed early stage of nearsightedness? If a child always blink, like excessively, they always blink, they actually need to squeeze their eyes, like, to see objects, and that's already one obvious sign. Number two is they keep rubbing the eyes, or they seems to be unaware of the distant objects. They show difficulties, or they need to sit quite close to television, or sit close to something to try to watch, to be able to see. Another very important thing is they looking at things with head tilted, right? So that's a also, if a child has that kind of habit, or sometimes they do, sometimes they don't do, and you need to be a parent, you need to pay attention to that. And then the last one is experience headaches caused by eye strain. So those are very small little detail symptoms in daily life. You can observe a child, then give you some hints that they might develop nearsightedness. To the how's the negative impact for a child to develop nearsightedness? So sometimes people might think, oh, we have uh, glasses, so a child just wear glasses, that's it, right? And it won't affect their daily life, but it's actually not true. So according to research, a child has nearsightedness, they will have way more chance, 1.957 more times to develop open angle glaucoma in the later age. Right? They also would develop some, they have more chance to develop cataract or other types of macular degeneration. And you can see the number is quite scary. It's 100 times more than other child. In their later adulthood, they will develop macular degeneration if they have early age myopia. Okay, so this is the number to increase your awareness, and also how this impact for them is for their lecture activities, and for the it's actually not convenience for a child to wear glasses, to be involved in all kinds of sports, right? And then also not very good for child to wear contact lenses. And I don't think any parents like their young children to wear contact lenses. So it create barriers for children to play sports. Right? So another one is uh, the in recent scientific literature, they find out if a child has myopia, it actually affects their mental status. Right? So it affects the personality even. Right? So this, we may not be aware of that right now, but right now after this lecture, hope everyone pay more attention for children's mental health. Okay. And then interestingly, since a pandemic, and they developed quarantine myopia. So this is actually a news in CTV. CTV News.ca is Canada's TV channel. So it shows up in 2020, since we enter in pandemic period, and there's more children develop myopia because they spend more time at home, they have less outdoor activities, and they use way more computer, iPad, a cell phone, like that. Right? So you can, when you see the figure, it's quite shocking, right? Compared to even just 2019, a year ago. A year ago, it's only 5.7% of 6-year-old child has nearsightedness, but in 2020, it's already increased a lot, like 10-15% increase. And how Chinese medicine understand myopia and understand the vision health. As you know, traditional Chinese medicine is a holistic medicine. So we don't only see eyes as a separate 5 sense organs. And this is reflect the vision, reflect the whole body's health, including the yin-yang balance and also qi blood level in our body. So we said the eyes are both the window for the mind and also a gateway to understanding one's general health. For adolescents, their eyesight is considered closely associated with their body constitutions, digestive function, and emotional well-being. So when you see a Chinese medicine doctor, we actually observe every patient when they walk in, and we observe their eyes, how their eyes look like. Do they look genetic from their eyes? Do they look good from the eyes, or they have a little bit drooping eyes, or they feel tired, or not enough spirit from the eyes? So this is a very important part in Chinese medicine, to observing the eyes and then the facial complexion, because this is the window of our body physically and mentally. So here I select some important classical expression from Huangdi Neijing, Yellow's Emperor. Right? That is the first grand classics were written in bamboo slips. So when you look at that expressions, basically we have a dialogue with ancient philosophies and ancient TCM doctors back to 2000 years ago. So you can see in Huangdi Neijing, it say qi, blood, and essence of organs ascends to nourish the eyes. So the eyes, the vision health rely on whole bodies, organs, qi, blood, and essence. If we would like to talk about which specific organ linked to the eyes, that would be liver. So here say liver opens to the eyes, and liver is the essence in the liver is very important to nourish the eyes. So in the modern research also find out liver contain large amount of vitamin A, and that's very important nutrient for the eyes, for the vision. So in the old time, we have a tradition to eat chicken's liver, right? Or mostly chicken's liver or goose liver to benefit the vision. So that's in the old time. And right now we don't advocate that much because our in the modern life, so many people develop high cholesterol, so we don't advocate that anymore. But you can see even in Europe, like French people also used to eat liver, right? So that is how close relationship between liver and the vision. The last one say blood nourishes the eyes and enables vision. So if a person have anemia, right, or even though your blood count is normal but it's in a lower range, right, you also will develop vision problem. So sometimes patient always develop blurry vision and floaters, right? So that's reflecting your blood level in the body. I know someone might have questions, right? But we will answer these questions later on. But also, also the doctors, Chinese or our colleagues from Vancouver or New York or California, you guys can answer the question in the chat box. Okay, thank you. Specifically, how do we diagnose the nearsightedness in TCM? It's number one, if a patient comes to see a Chinese medical doctor, and if children develop nearsightedness, it's heart yang deficiency. That's the number one. Number two is called spleen Qi deficiency. And number three, we call liver kidney essence deficiency. So you may wonder, like, oh, you just say liver and blood, like, why heart yang is the number one? So in Chinese medicine, heart yang is the force, is whole body's force, and it pumps the blood up to the eyes. So our eye system need large amount of blood supply. Right? So there's so much blood circulations around the eyes. So without a strong heart function, which we call heart yang, not enough blood can be pumped up to the eyes. So that's a heart yang deficiency is actually number one in TCM diagnosis. So patient, I also find out patient have heart yang deficiency when they were young. They also develop teenager type or early adulthood type of low thyroid function. Right? This is how I observe in the clinic lately, not lately, just in the past 10 years. So it often the case is an 18-year-old girl came to see me say, oh, I have a low thyroid function, and they already have nearsightedness, and they already developed low thyroid function a couple years ago. But because they are young, they didn't tell the parents. They feel very cold, they feel fatigued, lethargic, until it become very serious, and they approach the family doctor. They find out the thyroid function already low. Right? So there's a heart yang. Heart is the king in medicine, king in all the organs. Number two, spleen Qi deficiency. When we're talking about spleen in Chinese medicine, it reflects whole body's digestive function, including how you digest the food from the stomach, how the small intestine absorbing the food, and how the large intestine transporting, how the liver and gallbladder secretion of the enzyme or gallbladder juice. So spleen in Chinese medicine is a broad meaning of the whole digestive system. It's easy to understand if a child's digestive system is weak, he or she may not able to generate enough nutrient and may not generate enough blood to support the vision, right? So it develops many problems, not only vision problem. And the last one is liver kidney essence deficiency. This is the same as what I said before. It's liver blood deficiency, essence deficiency, right? So that's three major things we can treat and prevent and slow down the nearsightedness from Chinese medicine angle. So in summary, the key pathogenesis is Qi, blood, essence deficiency, or because not enough Qi and Yang to push the blood circulation, the blood flow slower inside the circulation, and it will start to develop blood stagnation. So blood flow be slower, even in young children. So we call blood stagnation in the eye collaterals, causes lack of nourishment of the eye orifices. Eyes are not able to see distant objects. So that is how Chinese medicine understand nearsightedness. Okay. And we will learn how to manipulate the points, right? But before we go to see the video, I would like to show you the lines. So very simple today, you just need to know three lines. Number one, you can see from the nasal bridge, right? Right now, if you touch your nasal bridge, right? Gently touch your nasal bridge, like near the eyebrow, right? Gently touch it, and then from eye bridge to the upper corner of inner canvas and to the inner part of your eyebrow, that is first line. We call line 1. And then line 2 is the midway of your eyebrow and to the corner, like to the forehead, like so you can see it goes to line 2. And then line 3 is outer canvas to the tip of your ear, right? So this is an easy one. So right now, please gently touch your outer canvas, right? And then draw a line to the ear, to the tip of your ear. We call ear apex. Okay, so that's line 3. Basically, between line 2 and line 1, that's, between line 3 and line 1, that's line 2. Right? So they're quite evenly spread out on the side of the scalp and the eyes. Is it clear? Okay, that's the surface anatomy of the point. Right? So here you can see today you will learn 7 points. 7 points. And here is a brief introduction of the anatomy of these 7 points. You can see these 7 points basically circle around, right? It's like counterclockwise around the eyes. And then the muscle around the eyes, it's not like the muscle around a other place. It's it's a circling muscle, right? Circling muscle. We call oculi muscle, because only this shape we can open and close our eyes, right? Oculi muscle, and you can see number 1 is near the nose bridge. Number 2 is on the superior corner, superior interior corner, right? Number 3 basically is on the eyebrow. 5, 3, 4 on the eyebrow. 5, 6 on near the outer canvas, and the number 7 is right below the pupil. Right? Very easy, and we need to manipulate counterclockwise. So pay attention to that. Okay, when you watch the video now, and then you will have better understanding. Okay, traditional medicine, Sinew Therapy. It's a very effective manual therapy. Key actions for today's manual therapy, and I call it easy acupressure, is dissipate sinew knots, release sinew tension, improve qi and blood circulation to improve vision. All right, it's the video's time. So I will stop sharing the PPT, and Bobby, would you please play the video? So we'll start from point 1. Bobby, there's no sound. We couldn't hear the sound.
Point 1 is a vertical ribbon like soft tissue. It locates below and in between the inner canthus and the nasal bridge. This point is good for sinus and eye condition, great to relieve visual fatigue and nearsightedness. Please pay attention to my hand. Place your thumb on the point and the rest of the 4 fingers on the left cheek gently kneads left to right. Please follow me and my rhythm. 1, 2, 3. 2, 2, 3. 3, 2, 3. 3 times to be 1 set. This video is to demonstrate how to locate and massage point 1 on others. With your left hand, gently hold the head, then with your right thumb, place on point 1. Start the kneading gently. Remember, kneading 3 times to be 1 set, and in total of 3 sets for better results.
Okay, so I don't know, do you follow and do it at the same time? So the point 1, as we see, is between the nose bridge, right? Between the nose bridge, and pay attention to the hands. You need to so separate your 4 fingers and then the thumb, right? So you can start massage yourself. Basically, you can do, if you do it for yourself, you can do it. You also can teach the children to do it for themselves. And doesn't matter which hand, but it's better right hand on the left eyes, and then left hand on the right eyes. Right, that's better. Oh, sorry, wrong. Right hand on the right eyes, but the four fingers is across, cover on the left. Okay, let me repeat again. Right hand, right, please do it together with me. Right hand on the right eyes and the right point, point one. Yes, very good. And neck, you do very well. And but with your four fingers, cover your left cheek, right? and then, and then press. If you press a little bit, use a little bit pressure, you can already feel very little bit sore, and that's the right point. So you also sometimes you can feel little nodules. It's a ribbon like vertical ribbon like nodules right at the bottom of the nose bridge, right? And that point is very effective, very effective. So right now you can follow me, like, okay, do start. Do you put your fingers on the point again, everybody, right? Okay, and 1, 2, 3, 2, 2, 3, right? 3, 2, 3. Yeah, so that's the right point. Okay, everybody are good? Right. So let's let's create the second video. And Bobby, maybe we can fast forward the first 20 seconds. Okay.
Point 2 locates at a depression near the medial superior of the orbit. As your thumb probes around, you should be feeling a knot-like tissue, and that is point 2. Exert a gentle force on that knot. 1, 2, 3, 2, 2, 3. Point 2 is a soft, tender knot tissue located at a depression above the inner canthus. Place the thumb on the corner of the inner canthus. It's a sensitive spot, so be gentle. Complete 3 sets for better results.
All right. So right now, let's practice the point 2. Right? So everybody, again, use your right hand on the right eyes. Right? So and then the 4 fingers, kind of the palm, cover your left. Right? So make sure your thumb is gently go in little bit on the eye socket, upper corner, right? Upper corner. And then if you, sometimes you need to go a little bit deeper to feel a little bit round ball. It's a little small round ball knots, right? And if you couldn't feel it, it go just a little bit deeper and you can feel pressure, So everybody, let's go there, right? And give little bit pressure on the inside of the socket, and then 1, 2, 3, 2, 2, 3, 3, 2, 3. Very gentle and slow, right? Very gentle and slow. It's very, very comfortable, right? It's very soothing manipulations. Okay, let's start the point 3, Bobby. And at the same time, we're waiting for the video. You guys can working on yourself a couple more times when we're waiting for the video. Okay.
Point 3 is another vertical ribbon-like tissue located around the medial 1/3 of the eyebrow. Both point 2 and point 3 are also great for relieving visual fatigue and nearsightedness. For point 3, you are looking for a vertical ribbon-like tissue. Please pay attention to my hand. Find the midpoint of the eyebrow, then probe around the section of its medial 1/3 to find this point. 1, 2, 3. Others should feel sore or numb. Lateral superior to point 3, that is where point 4 is. Both of them belong to the same tissue but different parts. Apply similar kneading techniques. 1, 2, 3. Complete 3 sets for better results. Point 3 and 4 can be connected through a line that runs from the middle of the eyebrow to the corner of the forehead. That's line 2. Point 4, a ribbon-like tissue, is located at the upper and outward of point 3. 1, 2, 3, 2, 2, 3, 3, 2, 3.
Okay, let's start the point 3 and point 4. They are actually same point, same line, but very close. So when you have your right hand ready, right? So you can find out the inner 1/3. If the eyebrow separate into 2 parts, is the inner 1/3. Right? And then when you press, you feel quite sore, and then a little vertical ribbon-like nodules. And if you didn't press the right point, you feel like less tenderness. So this is called the right acupoint. Once you press in the right point, and you'll find out, oh, little bit tenderness. Oh, that's the right point. Okay, so let's go here a little bit inner, and it's quite tender. Anyway, I feel mine is very tender. And if you move, let's say I move it to the center and I feel not tender at all. Okay, so this will help you to find out the right point, right knots. Okay? And then your thumb should be manipulate left, right, across over the knots, right? So everybody, are you ready? Press the vertical tendon, and then 1, 2, 3, left, right, 2, 2, 3, and 3, 2, 3. Okay, right now, don't leave your finger from your eyebrow and move a little bit outward and upper. Right? You will feel another knot, another vertical knot. It's quite tender. Right? So from the previous point 3, just move a little bit upper and outer. So you'll find out another knot, quite tender. So this is a point 4, right? Are you ready? Okay, then 1, 2, 3. Use your thumb. Cross over the knots like left, right, left, right. 2, 2, 3. 3, 2, 3. Quite tender. Okay. So in summary, you'll find out point 1 is near the nose bridge, right? And it's also vertical line tendon knots. Right? So the way you manipulate is your thumb go left, right, left, right, left, right, cross over that knots. The same technique on point 3 and point 4 is vertical line knots, right? And then it's like cross over left, right, left, right. And pay attention to the rhythm. You can see I do it very slowly, like so 1, 2, 3, right? 2, 2, 3. The reason like that is you want to give the tendon a bit more pressure, gentle but very firm, slow pressure to let it penetrate, to let the force penetrating through your finger and to the soft tissue. Right? So don't do fast. If you do fast, it's easy to injure yourself and injure the child, and also not enough force penetrating into the soft tissue. Right? So that's the key. Okay, go slower. And that's number 1, besides the nose bridge. Number 3, number 4, above the eyebrow, or on the eyebrow, above eyebrow. Right? Very tender. Right? Even though I press like that, I feel very tender. Number 2 is the only one and specific one inside of the eye socket, inside the orbit. Right? It's on the superior medial part of the eye socket. Right? And this is actually the acupuncture point we call bladder 1, Jingming. Jingming is the traditional point called BL1, Jingming. The name itself is brightness. Right? So it's very near Jingming. Right? And this one is a small round, soft ball. Right? So when you manipulate, circle around that area, and also very slow and gentle, but with a bit pressure. I hope this is quite clear, right? If it's not clear, you can post the question in the chat box. So Bobby, let's go to 5 and 6. And if you find out your right eyes or your left eyes which already feels brighter, like you feel like release, not that tender anymore. You can feel the differences between the right and left.
This video is to demonstrate point 5 and point 6. Place your right thumb on the zygomatic process of the frontal bone. Push upward gently, and that's point 5. 1, 2, 3. Complete 3 sets. Reposition your right thumb back to the zygomatic process of the frontal bone. Push down gently, and that's point 6. 1, 2, 3. Points 5 and 6 are on the same line. Locate lateral palpebral fissure, and you should feel a slightly protruded bone landmark beneath your thumb. Push upward gently to locate point 5 and start kneading. 1, 2, 3. You should feel a ribbon-like tissue during the kneading. 2, 2, 3. 3, 2, 3. Reposition your thumb back to the bone landmark. Push down gently to find a slight depression to locate point 6. 1, 2, 3. As well, complete 3 sets for better results.
All right, so point 5 and 6 are actually the same point. So the thumb, everybody like follow me. The thumb, like find your outer canvas, and when you gently press your outer canvas, you find a little bone, and then you find a depression. And if you do, if you are very familiar with massage, you find out the temporal 太阳is near that place, 太阳. But that point is in front of 太阳. We should say it's in between,太阳 and outer canvas. Okay, so look at me. 太阳 point, right? 太阳 point is here. Look at me, right? But in front of the 太阳 point, and when you press, it's quite tender. Right? So 太阳 point is totally in the depression above the zygomatic bones. Right? So this is in between. So again, use your thumb. Put your thumb on that bone, on the zygomatic bone. Point 5 is pressed up. Like look at here. I do it a little bit strong. Up. Okay? Up. And then point 6 is move your thumb on the original location and press downward. Down. Right. Down. Down. So basically this is the same location but 2 different directions. Move upward is 0.5. Move downward is 0.6. Okay, everybody follow me. Okay, let's start it. Okay, up, 0.5, up, 1, 2, 3, up again, 2, 2, 3, we're at the 0.5, right? Again, 3, 2, 3. Okay, right now, move your thumb to the point again, right? On the zygomatic bones, right behind the outer canvas, right? And you feel quite soft. Right now, 0.6, move downward. 1, 2, 3, 2, 2, 3, and then 3, 2, 3. Okay, so that's 0.5 and 0.6. So in summary, again, 0.1 is the nose bridge, right underneath inner canthus. 0.2 inside of the eye socket, right, medial superior. 0.34 eyebrow, right, eyebrow. 0.56 outer canthus, zygomatic bone. Okay. The last point is 0.7, so right besides the pupil, right? If you look at me here, if you press, right? But on the bone, not inside of the side eye socket. Right? Bobby, please prepare. That is 0.7. Okay, we are getting there. Not too difficult. Very easy.
While I demonstrate point 7, please pay attention to my right hand. Below the pupil, point 7 is another vertical ribbon-like tissue. Knead gently, left and right, on the point. 1, 2, 3, 2, 2, 3, 3, 2, 3. Point 7. A ribbon-like tissue that runs vertically, located below the middle of the infraorbital margin. With your thumb, resets on point 7 and then gently kneads left and right. 1, 2, 3, 2, 2, 3, 3, 2, 3.
Okay, so you have learned 7 points, right? And the last point, let's follow me. So it's right below the pupil, right? So press a little bit. Use your thumb press. It's quite tender, right? Quite tender. Okay, it's another vertical ribbon-like knots, right? Okay, left, right. Let's start. 1, 2, 3. Right? 2, 2, 3, 3, 2, 3. So that's the whole part. Right? Whole part. From point 1 to point 7, basically is from inner canvas, inside of the eyes, circle around the eyes, and then to the bottom of the eyes. Okay. From the, let's say, like that, from the one side is kind of clockwise, one side is anti-clockwise. It doesn't matter. Like anyways, from inside, from nose bridge, all the way circle around the eyes. If you follow working on one side, right now, that side should feel release. Right? And then the other side should feel a little bit strained, and you really want to work on the other side. Is it clear? So I actually would like to invite Doris to talk about her own experience. Like Doris have practiced this for like half year or more than half year, and her vision already improved, right, Doris?
Yeah, I didn't practice a half year, just only about a month. Since last month, I practice it every day for about less than 5 minutes or 10 minutes each time. And I got my nearsighted reduced by 50 degrees. Yeah, it's really helpful. I changed my glasses already because of the nearsight have been reduced. I'm still working on it. I think I'm expecting it's more decreasing. So I may need to replace my glasses in the near future. It is very helpful and it's very easy to manipulate. I'm very recommend each of ones to do it. Yeah.
Thank you so much.
You're welcome.
So yeah, so you can see it has a, if you do it every day, right? Let's say 3 times per day, right? Every time just take you 5 minutes. Right? Doris, how many times you do? Like we are doing 3 times per point. So how many sets you have done?
I'm not, I'm a bit lazy. I'm just doing once a day, just every morning before I get up.
Okay.
Yeah.
Yes.
It save quite a lot of time. I think if you you can practice it more, I think the result is much better. Yeah.
Okay, thank you. So you see, I highly recommend everyone. Mm, I see a question here. Can we do both hands together? I suggest you do one side, focus on one side, and then you do the other side. Right? Don't do both together. It doesn't take much time. And I highly recommend you guys do 3 times per day or at least twice per day. You can do it when you're very tired, when you use computer a lot. You can do it in between, right? It can help many types of vision problem. But if it's already severe degenerated, your eyes already severe degenerated, you cannot expect this one to change it a lot, right? But you will definitely improve the vision and prevent from the problem getting worse. That's my opinion, right? And someone is asking, can it have cataract? Like, this is a special design for children's nearsightedness and for eye strain, right? When over looking at the computer, over reading, right? For that, right? So we cannot say it will help with those type of severe degeneration, right? But it definitely can help you with vision problem. And prevention is also very important. We don't want you to really take action when you have a vision problem. Right? Use the thumb, don't use the index finger. Okay, use the thumb. You really need to use this posture. Okay, because you see someone asking me about index finger, right? Why we don't do that? Because you need to use 4 fingers to hold your head and thumb to press on the point, and it causes a force, right? Like that, right? Like you're holding something, right? So that's why uh you don't use index, you don't use your middle finger, right? So you need to have this kind of force, like holding your head, one side press the point and one side holding your head. When you manipulate for your children or for other people, make sure you hold their head with one hand and the other hand manipulate. Also use your thumb. Okay, that's the standard acupressure. Is it clear?
Very clear. Thank you.
You're welcome. The first point is also good for sinus problem, sinusitis, right? And I use those points in my clinical practice. I use those points for acupuncture, and it also has a very good result. Very good result. For, let's say, this one is similar to B-tone, right? And then I also needle this point from upper downward, and also I find out very good result. Patient have very good feedback, right? So same. Someone asked me about cataract or other vision problem, right? So I just want to say this is special design for children's nearsightedness, right? For prevention, for slow down the decrease of vision, and then so release eye strain. It's not designed to treat severe eye degeneration. Okay. Yes, very good. It saying leave a message here. Say step by step with clear instruction and demonstration that apply to both adults and children. Yes, it's saying that's right. Thank you for your comment.
I think this is much benefit for the adult is because of the dry eyes or the tidiness or the fatigue of the eyes. It's really helpful. Just before I follow Dr. Gao about the massaging my right side, and I feel it's really relaxed and it's more moisture. I really want to massage it again for my left side. Yeah, so it is really, really helpful.
Thank you, thank you. Someone is asking like children born with cataracts, right? And yes, I say yes. For these friends, like I don't know your name is a WVML, right? Your it's better for children with that. It's for sure you need to see the specialist, but there's no harm for you to massage this child with this technique. There's no harm at all. I cannot say it will change the condition because we don't have that kind of a real clinical practice to massage to change that vision problem. But I should say there's no harm to massage. Okay. Yeah.
Thank you, Dr. Gao. It's very detailed explanation and it's very good lecture. I think we can learn about it, practice from now. You will see the result in the future. I mean, just maybe a few times, a few days, you will feel that.
Yes, thank you, Wendy. And so if because I don't want to retain you so much. Thank you so much. I don't want to retain you guys for too long, and thank you. I appreciate your effort to coming here. To spend your time and to join us. So if you don't have any more questions, I want to pause the meeting, and if you have any further question, always welcome to join our group and ask question in the group or email us. Okay, and Annette, thank you so much to join my lecture again, Annette. All right, so I think Wendy, should we pause the meeting now?
Yes, I think
Thank you so much.
You're welcome.
This is great. Yeah. Even you can improve the dryness on the eyes too.
I think definitely it can improve the dry eyes.
Mm-hmm.
Mm-hmm.
yeah.
Thanks for giving us such a great lecture.
Yeah.
You have a great day. Yeah.
Okay, thank you for your feedback.